Good afternoon.
Good afternoon.
We made it. Look at us go.
And we are right on time.
Skills, even
That's
after
right.
the phone ringing. So today, what are you doing?
I'm looking at this.
Oh, okay. So today we're going to talk about seizures.
Yes.
Can I play my song?
Yes, you can play your song.
You can't see it, but I'm shaking my booty.
Thank goodness they can't see it. It's the highlight of your week, getting to play and watch me annoyed. Yes.
Making you watch me dance in a
See,
ridiculous
when you
way.
do those kind of things, it's like I'm a cat. I'm just like,
Just sitting there and judgy.
Right, being judgy. Yeah.
Uh-huh.
So seizures.
But I feed you food, so then you
Well,
stick
you do.
around.
Uh-huh.
Mhm.
We just ate a ton of Olive Garden.
So many breadsticks.
It was delicious.
They just kept coming. Like, how many packs were it? 5?
5.
I don't even know why.
Well,
It's fine. We ordered 3 entrees and we have 5 packs of breadsticks.
I feel like they gypped us 1 pack of breadsticks, if you think about it, because
we should have had 6.
we should have had 6
each.
Yeah. Well, because we each got an entree, and then we each got a dipping sauce, which comes with breadsticks. So technically, we got gypped a package of breadsticks.
I don't know how many breadsticks you think we need in our lives. I had like 3. And
I had 2.
stuffed.
We don't need that many. But if you think about it, there should have been 6.
Take it up with the Olive Garden. I don't know what to tell you. So today we're going to talk about seizures, assuming that we can stay awake long. So seizures are, I think they're relatively common.
Ish.
I mean, it's not like an everyday sort of thing, but it's kind of like a monthly sort of thing that we see, case-wise. So they're certainly not unusual in our patients. So we thought we'd talk today a little bit about, basically what are the causes of seizures, what do seizures look like, what can we do to treat them, and diagnose and all that. So so let's talk about first, what does a seizure look like?
So it can be a lot of things. Typically, we see like some rigid, they're just kind of stiff, not really moving. They can be shaking. Their kind of jaw can be tremoring. Facial twitching is like mild seizure. Whole body like convulsions, like you would typically think about with a seizure.
Yeah. So there's focal seizures, which are going to be just things that are happening in a specific area of the body and not anywhere else. So like Crystal said, like facial twitching would be considered a focal seizure. And with the focal seizures, they don't tend to lose consciousness. So I mean, it could be a leg twitch. It could be, they're bobbing their head or anything. But they don't tend to lose consciousness. They are still responsive. Whereas with the grand mal seizures, that's more kind of, I think, the big ones that most people think about, where maybe they fall over, they could be rigid, or they could be paddling. They can be doing any number of things. They, a lot of the times during the grand mal seizures, will either urinate or defecate because they've lost control. They are not conscious during that. And I think that's a big thing for people to keep in mind, because it's a horrifying sight.
It's terrifying.
It is terrifying, and especially if you've never seen your animal do that before, holy cow. But when they're having those grand mal seizures like that, they are not conscious. They don't feel pain. They're not scared. They're not with it. So and that's why it's important too, especially as we talk about like different treatments and things like that. Don't put your hands anywhere around their face or mouth, because they could potentially bite you, and it's not intentional. They don't mean it. It's just what's happening in their body. It's just spasming, and they can't control it. So Big
Sometimes
teeth.
they'll bite their tongue.
Yeah, they can. Or their own lips or something.
Yeah.
So there might be some blood that happens as well. It's not usually going to be anything that's like life-threatening or anything like that. But yeah, just be on the lookout for that. So like I said, really a scary thing I think for a lot of owners to see, especially for the first time. And I think probably even if you've seen it multiple times, it's still not fun.
Yeah. I mean, I've seen it here quite a bit.
Mm-hmm.
And one of mine actually had a seizure at home where he fell off the couch.
Yeah.
And that was scary for me because, like she said, he had never had a seizure before.
Right.
He hasn't had one since.
Mm-hmm.
But he fell off the couch. He went stiff. His eyes were glazed over. He wasn't there.
Mm-hmm.
And the biggest thing, he did urinate.
Mm-hmm.
But the biggest thing, I just held him down so that he couldn't flail or hurt himself or anyone else, or that was
anything you can do to keep them safe while you also still being safe. So if they're going to be, make sure they're not going to fall off furniture or fall downstairs. Things if you can stop those things from happening, that's your best bet. Just keep your hands away from their mouth and face.
Mm-hmm.
Big blanket or something over the face is totally fine. So when we see seizures, for the grand mal seizures, there's typically 3 phases that we see. So we have pre-ictal, ictal, which is the actual seizure itself, and post-ictal. So pre-ictal, so meaning before the seizure, there's typically a range of symptoms that we can see. It's like the animal can almost kind of feel it coming on, and they may feel a little bit weird. So they could be, walking kind of drunk. They could be drowsy. They could be agitated. There's all different things that can happen beforehand. And like I said, every animal's different, but there's typically this phase of some kind of abnormal behavior that happens a little bit before the seizure. That little bit might be like 5 minutes, could be an hour. It just, again, depends on the animal, but there's usually some sort of other signs that something is coming on. Then you have the actual seizure itself. So when we ask how long the seizure lasted, it's that main portion of the seizure that we're referring to. We don't necessarily care about the pre-ictal part. We don't care about the part afterwards. We care about the seizure itself. And that is part of what guides us and what we're going to do as far as treatment. And it may help with diagnosis and things like that. And then post-ictal, again, variety of symptoms. They could be dopey, they could be agitated. A lot of them will be very hungry. That's very common because their blood sugar will have dropped because all those muscles were working and burning those calories and that. And so they'll typically be hungry afterwards. Again, they might circle, they might act drunk. It just depends. And that can last for quite a while too. Sometimes it's just a few minutes. Sometimes it's up to 24 hours. So that's an important thing to consider as well. And we talk about when we're trying to determine if we're treating or how we're treating and all that. So those are the typical stages that we'll see with a grand mal seizure. So causes of seizures. I would say the bulk of the seizure cases that we see are probably idiopathic epilepsy. So idiopathic is a fancy way to say that we don't know what the heck caused it. We can't find an underlying cause. There's nothing infectious. There's nothing wrong with their organ function. There's no tumors or anything like that. There's no cause that we can find. We lump them into just idiopathic. And that's typically the cases that we'll see. They're usually like between 3 and 7 years old-ish, having seizures for the first time. Usually it's epilepsy. So, we'll do, first-time seizure patients, they'll come in. We'll often do some blood work and just make sure that we're not seeing anything abnormal with any kind of organ function, liver especially, or problems with their red blood cell count or white blood cell count that might indicate that there's something infectious going on. So that's usually where we start. For most of the patients that are in that 3 to 7 range, that's usually where most people stop. In a perfect world, next step would probably be to go see a neurologist and get an MRI done to rule out anything going on up in the brain. But that's pricey. When you're talking about spending $2,000+, most people can't do that.
Yeah.
So then we just end up like tracking the seizures and then talking about treatment. If we find anything abnormal with their labs, obviously that would be the next step, is to address those things. But like I said, most of them are epilepsy, and so not usually anything. But there are infectious things that can cause it, fungal infections, different bacterial infections that can cause seizures. In a puppy, the December virus can cause seizures. So that's why we vaccinate for December. In senior pets, so 7 and over, again, assuming that everything else on their labs are normal, most common reason that we see is a brain tumor. Not always, like I said, this is just what's most common, what we see, but that's usually kind of assumed to be the underlying cause, unless somebody can go to get an MRI and rule that out. So, and I usually have the discussion with clients that if they have a senior pet that's having seizures for the first time, now if they started off when they were like 3 and they're still having seizures when they're 14, well, it started out when they were younger, so that's still epilepsy. But like seizures for the first time at like 10 years old, probably not great. And honestly, unless you are somebody that would be willing to pursue surgery if a brain tumor is operable, there's not to me, other than just the knowing, which is nice, but I think that's an expensive, nice thing.
Right.
For me, if it's not going to change what we're doing treatment-wise, I don't really push people into it, because why spend $2,000 on something that's not going to change how we're treating your pet? I'm just trying to be realistic.
Yeah.
I feel like that money could be better spent elsewhere. Like if we put them on medications, paying for those medications, or doing good drug monitoring and that. So that's usually a conversation that we'll have there. So those are the most common causes that we see. Like I said, the bulk of the patients that we see that have seizures, it's epilepsy. Like your dog.
Like my dog.
Yeah.
A weirdo.
Yeah. That may or may not have been pushed over the edge with drugs. And there are drug reactions and things like that. Oh, I've got this nice little sunspot on my face. It's like a sun mustache. Look at that. That's fun.
I was going to say in the very beginning, it's very bright.
It's on my nose. I'm easily distracted, I'm sorry. So there's certain drugs, like acepromazine, in a patient that is already prone to having seizures, it may reduce their seizure threshold. I know, I can't not see it now.
Do you want to scoot over?
Well, it's fine. I'll
there.
Be closer to you.
We'll just snuggle.
I'll scoot you over here. Okay. So, it's just on my cheek. Whatever. So, better than a mustache. So acepromazine is a drug that, if they're already likely to have a seizure, meaning they may not have had them yet, or maybe they have, it will reduce their seizure threshold, meaning reduce basically the inhibition of the seizure.
So it's not causing a seizure.
Yeah, so it's not as like causing it specifically, it's just making it more likely for them to seize. Does that make sense?
Yeah.
Okay.
Basically, it's
in a patient that's not got any they're not prone to seizures at all, it's not going to have that effect. So it's not necessarily going to cause the seizure, it's just going to make it more likely for it to happen.
If they were prone to having them already.
Yeah, exactly.
So my dog, he had acepromazine because he was a rescue.
Mm-hmm.
He was very nervous.
Yeah.
And so I gave him an acepromazine, which is like a little mild sedative, to help calm him down. And that is when he had the seizure.
Mm-hmm.
Like I said, he hasn't had one since that I've seen. He doesn't get that medication anymore.
Right.
And hasn't had any issues. So he may in the future have seizures.
Mm-hmm.
But
or he might not.
Yeah, or he might not.
And that's one of the tricky things I think with seizures too, is because if they have that first one, that might be the only one that they ever have. Or it may be the start of a whole bunch of them. It varies so wildly, which is what makes it hard. So treatment-wise, let's assume we're talking about epilepsy or maybe it's a brain tumor, but we're not going to do surgery or anything else. So we're just treating the seizure itself. So what we'll typically do is step one, track the seizures. So what are we looking for? Do you remember?
No.
So we want to know the number of seizures that they're having over a given period of time. Yeah, so we also want to know, how long the actual seizure portion is. Nice to know the rest of it too, but typically, like I said, we're looking for the actual seizure portion. If it's 5 minutes or less, okay, cool. If you have a pet that's having a seizure that's lasting longer than 5 minutes, get them loaded up in the car if it is safe to do so, and get them somewhere so that they can get some medication on board to stop the seizure. And half the time they'll probably stop seizing in the car. It's okay. They should still be checked out. But yeah, so that's usually what I tell people. And to let your vet know if you end up going someplace emergency, and I don't know, they may or may not start your pet on medications for long term, but for sure talk with your regular veterinarian about it if you went someplace emergency. So if they're having, my cutoffs are, and I'm sure this varies a little bit from doctor to doctor, if they're having 1 seizure a month or less. If their seizures are less than 5 minutes and they're not having like a bunch of seizures in a row, which should push them over the first qualifier anyway.
Yeah.
I don't treat those. I leave it be, because the medications that we use can be costly, and they can definitely have side effects. So if there's not going to be a whole lot of benefit to it, I don't see a point to treating them, because we don't necessarily aim for 0 seizures in epileptic patients, because they're not, driving cars or anything that's going to put them in major danger like that. Not like us, when people, the goal is 0 seizures, but they also probably work a little harder to get a diagnosis than that.
Yeah.
So because our goal isn't 0 seizures, and we're trying to balance the risks of the medications with the benefits, like I said, 1 a month, that's not so bad. We can handle that. But if they're having clusters of seizures, meaning they have a bunch that are back to back, or if they're just having more than 1 a month, or they're lasting more than 5 minutes, then I'll typically start them on treatment. Yeah. So, like I said, we do blood work first, make sure everything's all good, because that may affect what medications we choose. Certain medications like phenobarbital are hard on the liver. It's an inexpensive medication, but it does require more monitoring than, say, something more expensive like Keppra. Keppra is a more expensive medication to purchase, but it's pretty darn safe, with a really wide safety range. And you taking messages?
Oh, sorry, no.
It's got a wide safety range, and there's not really a lot of drug monitoring we need to do. We don't have to run Keppra blood levels or anything like that. We will check blood work typically once a year just to make sure everything's good, but we don't usually see any changes from it. So, and there's a bunch of other medications. I know I have the sun back on my face.
Oh, that's not what I was. No, you made a weird nostril picky noise or something.
Oh, did I?
Yeah.
I don't know. What was I saying? Oh, there's a bunch of other medications. Zonicimide is one, bromides, and some of that, which one your vet chooses may depend on what medications they've had the best luck with, and it's just personal preference. For me, I like Keppra a lot. Another inexpensive one that's pretty safe is Zonicimide. I like that one quite a bit for the smaller patients, so a 20-pound or less dog, I'd probably go with Zonicimide, because the Keppra, the extended release, you're not supposed to split the tablets, so we're kind of limited on what size patient we can use that on. It's usually the bigger guys. So, but also cost-wise, Keppra is kind of on the pricey side of things. So yeah, it just depends on what you're seeing at home. What are you able to do as far as follow-up, and that if we do phenobarbital, like I said, it's an inexpensive drug, but you're looking at doing blood work more frequently, including blood levels of phenobarbital. That is something that we try to keep within a certain range, because we can get toxic levels of phenobarbital, which is not good. No bueno, bad for the liver. So, and then if we're seeing changes, if we're on something like that, and we're seeing blood work changes, we may need to switch meds and that. So, yeah, there's a whole lot of reasons.
There's also food.
So diet, they are still kind of looking at diet right now. There is a food available from Purina. It is a prescription diet called Neurocare that has helped some patients have fewer seizures.
It's expensive.
It's expensive.
Very expensive.
Yeah, it was like, what, $100 for like a 20-pound bag or a
Isn't it
30-pound
like a 17-pound
bag?
bag?
Is it worse than that? Yeah, it might be.
I think the largest size that it comes in is like 17.6 pounds.
Yeah.
And it's like $100 a bag.
Because we had those 2 dogs that we tried on it, and they were bigger dogs. They were having to go through it pretty darn quickly. Like, it was like a bag every couple of weeks. So that's expensive. I mean, it's something you can try. So what the Neurocare is basically medium chain triglycerides, so MCTs, are supposed to help with inhibiting seizures. Like I said, some people see benefit from it, some people don't. It's certainly, especially if you can afford it, it's worth a try, because we're not necessarily going to be worried about like side effects from it. But yeah, it may or may not help. You give it a try for a few months. If you're not seeing any improvement within a couple months, then I'd probably switch back to your other food. So somebody asked about a low-fat diet, and I'm not sure where you read that. Because basically, the medium-chain triglycerides are basically a fat, and so that kind of helps inhibit that specific kind of fat or fatty acid helps to inhibit seizures, and so that's why there's another theory that maybe like some keto style diets may help with that as well. So then we're talking high fat. So the opposite. So I'd be interested to know where you read something about a low-fat diet, or who told you that. That's interesting. Low carbohydrate, and with the high fat is kind of what they're looking at there for the keto diet. But like I said, it's still kind of being researched right now. There's not a whole lot of studies out on it, and it's kind of, they're not great studies, the ones that are out there. So, I think, again, it falls into the category of, is it going to hurt? As long as you don't have a pet that's going to be prone to something like pancreatitis, so I probably wouldn't use it in like a Yorkie. So, an animal that basically you don't want on a high-fat diet, I think it's worth a try. But I wouldn't place all my bets on that one. I wouldn't skip medication in hopes that this diet is going to help in a patient that needs medication.
Yeah.
If you have a patient that like maybe had one seizure and you want to try it to try to prevent future seizures, you could. I mean, they might not ever have another seizure again anyway, but it's not gonna hurt.
Yeah.
As long as they'll eat the food, it's not causing an GI upset. Okay, I think it's reasonable. There's also, I've heard of people using things like CBD. Again, kind of going back to our talk about CBD, we don't really know dosing in that, and it's not really something we can officially prescribe, so your mileage may vary on that. Probably would not. What?
Your mileage may vary.
Have you never heard that?
No, not car term, like speaking about cars.
It's a thing.
Did you see my face when you said that?
Yes. Anyway, so your experience could vary. Is that better? Okay. It means the same thing.
Mileage may vary.
So CBD may or may not. Again, I probably wouldn't do that as like my sole treatment for an animal that I would otherwise classify as somebody who needs.
Don't place all your bets on that.
Yeah.
Would that be another term?
Sure.
But
an animal that otherwise meets all the criteria for medication.
All
your eggs in that basket. Yeah. So if they meet criteria for medication, I wouldn't just use CBD oil. I would be doing medication, and then you can add in CBD oil if you want. I feel like best case scenario there is just reducing the dose of the medications that we might need. So that's kind of what we're looking at. As far as things that trigger seizures, like we talked about, so if we have an epileptic patient, there are things that can happen that makes them more or less likely to have a seizure. One being certain drugs. You know, if we have an epileptic patient, we don't want them to have acepromazine. That's less than ideal. And, I mean, I'm sure I've gotten it before, and it's fine. But in general, it's something we try to avoid. There's usually other options we can go with. The other thing is anything that is highly stressful can cause them to be more likely to have a seizure. We had a patient at our last office that if they came in the door would have a seizure. Yeah. So we saw them in the yard to the side, and then everything was fine. And I've seen that one other time where we had a patient where, like, literally just walking in the door to the vet hospital was enough stress that they had a seizure. So they just didn't come inside anymore. Yeah. And that's okay. We can work with that. That's fine. Like I said, we see them outside or do a house call or see them out in the car, whatever. There's a lot of ways around that. Or maybe we pre-medicate them with something before they come in to reduce their stress level. So stress can certainly cause it. Exercise, I think it just depends on how strenuous that exercise is. I think that could certainly fall into like the stress category of things. If it's really strenuous exercise, just normal like going for a walk shouldn't cause anything like that. Or normal play. As well, I would probably try to keep it from being like an extended period of time, but like 10-20 minutes out in the yard shouldn't. But certainly if your pet as an individual you're noticing is having seizures when these things happen, then obviously discontinue doing those things. You know, if you notice a particular correlation with your own pet, just like with foods too, you know, they've read some things, because there's of course all kinds of stuff on the internet. It could be your best friend or your worst enemy. Talking about like food sensitivities, like gluten and stuff like that. It's really not anything that's been proven, and so probably not happening. But if it's not going to put your pet at risk for other things, and you're feeling like you're seeing a correlation there, then avoid those things if you can. Like, oh, I give my dog a milk bone and he has a seizure. Does that mean milk bones cause seizures? No, of course not. Millions of pets have them every single day with no problem. But maybe, for whatever reason, your individual pet is having this reaction. So, is it going to hurt for them to be without a milk bone? No. They're probably fat anyway.
They probably don't need it.
Most pets are. So like things like that, I think it's not going to negatively affect their lifestyle, and you think you're noticing a correlation there, fine, try skipping whatever that thing is.
Yeah.
What else? Have we covered everything?
Some of the medications can take a while to get in their system, so it's not going to be like an immediate thing for some of them.
Yeah. Sometimes there's some dose adjustment that can happen. So that's, again, even when your pet is on medication, keeping track of those seizures and how frequently they're happening is important so that we know if we need to make a dose adjustment. Sorry, I'm boring you. If we need to make a dose adjustment or switch meds or something along those lines, we can do that based on how frequently they're having seizures.
Yeah.
What else you got?
What?
Nothing.
You're looking at my ugly mug?
I was looking at your ugly. Actually, your ugly mug isn't over there.
No, it's not. I think just the biggest thing, seizures can be scary.
Oh, yeah.
And if you're concerned, definitely call your veterinarian and discuss it with them. Like Dr. Hogan said, I know it's not ideal for them to have any seizures. Right. But like she said, 1 a month is what they consider controlled. So it's hard. I think it's important to understand that expectation as well. Yeah. Like, sure, it's super awesome if we can get them to 0 seizures. That's amazing. But it's not necessarily our initial goal. So
Yeah, I think that's important to know.
You're gonna have breakthrough
Yeah.
seizures, unfortunately.
Yeah. It's gonna happen. I was gonna say something about, dang it. Oh! It's just an anecdote. About our one patient that previously has had seizures, but only when I'm out of town. He was doing well on his medication, but then I would go out of town, and then I'd get a text message, and I was like, oh no, and of course I'm not there. So then, like, there was one time I texted them ahead of time, I'm like, just so you know, I'm not going to be in town this weekend. Be ready.
Be ready.
Poor baby.
Yeah.
He's doing good now, though.
But it's rough. It's hard, and it's hard to see them that way. But just remember, they're not. Most of the time, you know, when it's a full-blown seizure,
Mal seizure,
they're not
conscious.
They're not there.
Mm-hmm.
So
yeah, so I think that's one thing that's important, because like I said, it's horrifying to see it. I mean, like, they look like they're in pain and scared, and they're not conscious. They don't know.
Yeah, when their whole body's trembling, and you're like, oh God, they're so scared.
Mm-hmm.
They're not.
No, they're not. So that's a blessing for sure. So, if you have any other questions, or there's anything that you need more information on, let us know. Otherwise, I think we'll see you next week.
What are we going to talk about next week?
I haven't decided yet.
Oh, okay.
Sometimes I just like to surprise you.
You do?
Mm-hmm.
I know that you do. She likes surprising me with everything.
Maybe we'll talk about thyroid disease next week. That was a great face.
See you guys later.
See ya. Bye.